Lee, and I chair the Family Resource Planning Council. The Family Resource Planning Council is organized into 10 regions up and down the state. I'm also a member of Region 2, which represents Bergen, Passaic, and Hudson. A few months ago, one of our members, Pat Panay, who's in our audience today with us, with her daughter, Joanna, said, we really need to focus on insurance. Pat is uh, an advocate, a longtime advocate in her town, and she kept getting questions that were more than just what is Medicaid, what is Provide, what is Medicare, when do I sign up for Medicare? They were much more complicated. They represented the whole range of insurance over a person's lifespan. We started to work in Region 2, putting together some of the questions. One of our members, Jackie Saltzman, who I think is on Zoom right now, brought us a number of questions and answers, but we quickly realized that we need more resources. This is more than we could possibly try to just go through and search on the web to find answers. So we contacted Connor Griffin from the ARC of New Jersey, Jennifer Langer Jacobs from the State Medicaid Resource area, and Gwen Orlowski from Disability Rights New Jersey. And they said, sure, we will help you. But we also said, but we don't want the regular presentation. We kind of know what we want to hear on this seminar. And they said, we will work with you because that's how dedicated they are. They really want to be able to answer questions from families with people with disabilities. So thank you, Gwen, Jennifer, Connor, for doing this. I know it was more than you usually do, but it's really well appreciated. But that is what the Family Resource Planning Council does. We reach out to families, we figure out what the issues are, and then if we can't answer the questions, we'll reach out further. A few years ago, one of our members experienced a horrific loss. So our council with the New Jersey Council of Developmental Disabilities put together a health and safety subcommittee. And we wrote a white paper identifying issues and possible solutions. And we brought it to Jonathan Seafried at DDD. And we've been working on, we've actually been able to move the needle on issues that affect the health and safety of our people. Under Paul Blaustein's guidance, who heads the New Jersey Council of Developmental Disabilities as chair and continues to lead the Health and Safety Committee, we are continuing that work. So I'm really happy everyone was able to join us. I'm going to turn this over to our panelists so they can introduce themselves and a little bit more about their background. So Connor, I think you were first up.
Good morning, everyone. My name is Connor Griffin. I am the Director of Healthcare Advocacy with the ARC of New Jersey. For those of you who don't know, the ARC of New Jersey is the state's largest organization advocating for and serving children and adults with intellectual and developmental disabilities, as well as their families. Community-based services are available statewide through our strong network of local county chapters. We have 20 chapters serving all 21 counties of New Jersey. And if you or a loved one is in need of services or support, or just doesn't know where to go or how to proceed, I encourage you to please visit our website at www.arcnj.org or email info@arcnj.org. And if you have specific healthcare related questions, please feel free to visit my healthcare advocacy program page, or you can, of course, email me anytime. And thank you for being here on this rainy Saturday morning.
I think I'm next. So I'm going to just move this a little closer. Good morning, everyone. I am Gwen Orlowski, and I'm the Executive Director at Disability Rights New Jersey. Disability Rights New Jersey is the designated protection and advocacy agency for the state of New Jersey, and we operate under federal law. And that's a mouthful, so I'm just going to take a second to say what that means. Disability Rights New Jersey is a nonprofit. We came out of state government in 1994. Every state has a protection and advocacy. Most exist in nonprofits now, started in state government. I think only a handful are left in state government. And we were designated by Governor Christy Todd Whitman back in 1994. That's why we say we're designated. And once designated, always designated, absent good cause. So it's not something that changes from administration to administration. And we operate under a series of federal statutes that I think personally makes us the most awesome organization out there around civil rights for people with disabilities. And that federal authority allows us to conduct investigations of abuse and neglect that are brought to our attention in any setting where a person with a disability is receiving a service. We also get to monitor any setting where a person with a disability is receiving a service. I say that's our boots on the ground. We get to go in to any place and say, we're here, we're coming in, we want to talk to your staff, we want to talk to people who are receiving services here. And as just a quick little funny story, I did that once on a Sunday in a nursing home up in Sussex County and got barricaded into the administrator's office because he didn't believe my monitoring authority. So sometimes we have to, I know, it was quite something. It was a dramatic morning. So sometimes we have to enforce that authority through federal courts because people just don't quite get it. So that's our investigation and monitoring authority. And we have a mighty team that does that. But just to give you perspective, we have 5 people for the entire state of New Jersey to do investigation and monitoring across all the work we do. So I know, small but mighty. We also are a law firm embedded in side of the P&A and under federal law. We do individual representation. We can do class actions. And we can also file suit through our associational standing. We stand in for people with disabilities as plaintiff. And many of you may know last week we sued the state of New Jersey over our state psychiatric hospitals, and we did that using our associational standing. That is a very significant authority we have under federal law, which we use judiciously, but it's there when we think it needs to be used. So, and the last thing I'll say is that we do all of our work through a process that's required by the federal government called priority setting. Terrible name, because all the work we do and needs to be done is a priority. So we call that our goals and objectives. And if you go to our website, you can see our current 3-year plan for goals and objectives and get a really good sense. They're very, our objectives are very concrete and measurable, so you can get a good sense of what we're working on right now. And thank you for having me today.
Good morning, everyone. I'm Jennifer Langer Jacobs. I am the Medicaid director, which means I oversee the Medicaid program for the state of New Jersey and also the Children's Health Insurance Program. We put those together and call them NJ Family Care. So when you see the NJ Family Care name, that's what we're talking about. And then several other programs actually that fly a little bit under the radar compared to those big ones, but are important in sort of the healthcare ecosystem here in New Jersey. And I'm really glad to be here this morning with partners. Gwen described, this is very serious work. It is established in state and federal law. There are times when litigation occurs. There are times when things get tense. I was also in that nursing facility in Sussex, and we are good partners through all of that. And I think of that as important to the success of the program because although there are times when things are really challenging for us, that partnership makes us strong and lets us do the work the best way possible. So we navigate that. Yep. And I appreciate those partnerships. So in New Jersey's Medicaid program today, we are covering actually 2 million people. And you may be aware that we are in the process of redeterminations, eligibility redeterminations after the end of the public health emergency. We'll talk a little bit about that today. And I'm glad to be here with you. This is a community we have a lot of communities in New Jersey, and serving 2 million people, we have a lot of communities represented within the population that we serve. This is a community that is particularly near and dear to my heart for a very long time. So thank you for inviting me to be here with you today, and I'm looking forward to the conversation. Okay. What's next, guys? You want us to skip to slide 8? Sorry. Okay. Who's on slide 8?
I think it's Connor.
There's
So-
different types of insurance here.
Yeah.
Okay, so I'll get right into it. So the major types of insurance in the state of New Jersey. So I'll start with one that many people probably know well, and that's private health insurance. Now, the main way that private health insurance is administered is usually through an employer. Now, what happens for a person with a disability is the majority of the time, a person with a disability will get that health insurance through their parent's employer up till age 18, which that is the point where a person is considered an adult. And usually a lot of what happens is a person will apply for SSI, or supplemental security income. And if someone is approved for SSI, they automatically become eligible for Medicaid. This does not require a separate application. It is something that follows with being approved for SSI. Now, what many people I know might be unaware of is that you can have that private health insurance under a parent's plan in addition to Medicaid. It's not one or the other. You are allowed to have both. Now, usually what happens in the state of New Jersey is for most individuals, they're allowed to stay on that parent's plan until the end of the year that they turn 26 years of age. So that's through December 31st of the year they turn 26. Now, there's a special NJ law that does allow someone with a disability to exceed that age 26 to remain on their parent's plan. That is as long as certain criteria are met. If they remain dependent on the parent, they're primarily not working and making their own source of income, then that is how they remain eligible indefinitely beyond age 26 to stay on the parent's plan. Now, there are certain circumstances that can affect that, like if, say, you change employers, for example, then there's no guarantee if you're switching from one employer to another that they'll necessarily cover your child with a disability. That's at the discretion of the employer. But so how it works is what we recommend is when that child is approaching that 26th birthday, you want to really be proactive about this and well ahead of time. You want to make sure you're contacting the healthcare administrator at your place of employment, whether that's the HR department, whoever that may be. You want to get in contact because they're going to require the necessary documentation and paperwork. And you want to make sure you're all set when your child turns 26 and reaches the end of that year, that they are all set to stay on the plan, continuing beyond age 26. So that's how you see private health insurance work in collaboration with Medicaid. Now, I just want to note that what you can't have is you can't get private insurance off the NJ marketplace and have Medicaid. Those would be considered duplicative coverage. This is referring to having that coverage through a parent's employer and having Medicaid on their own. So I just want to make sure that important clause is met. Now I'll move into describing Medicaid a bit. So this is New Jersey's public health care program. And it gets a little confusing, but there are two primary programs. There is NJ Family Care. This is also known as Magi Medicaid, and it's related to Medicaid expansion. This is tied to someone's income. It's not based on having a disability. So the criteria for being eligible for that form of Medicaid are a little different. For the vast majority of individuals with disabilities, you're looking at the Medicaid known as aged, blind, or disabled, commonly known as ABD Medicaid. And this is tied to someone having a disability, and there are numerous programs that fall under NJ Medicaid in this area. As I had previously mentioned, if a person with a disability is approved for supplemental security income, which most people know as SSI, then you're automatically going to be eligible for Medicaid. Now, for some individuals, if the income is too high to receive SSI, which a lot of time this can happen if, say, a parent retires and starts collecting Social Security prior to an individual turning 18 and being able to apply for SSI in their own right. Then this is sometimes a way that their income might be too high and they're not going to be able to apply for SSI, but there are still other ways to access Medicaid. Once again, most individuals that have a disability, they are going to have this ABD type of Medicaid. That's the most common way that this occurs. Last, I'll get into Medicare, and this is one that people know well. This is the federal health insurance program that people usually think of when we're talking individuals who are 65 years of age and older, but certain individuals with disabilities do qualify for Medicare. So a person with a disability is going to automatically start receiving Medicare after the receipt of Social Security disability income, commonly referred to as SSDI, after 24 months or 2 years. Even if the individual is under 65 years of age, if they're eligible, they're receiving SSDI, and they have a disability, then they can start receiving Medicare. And they can have Medicare in addition to Medicaid. They can have both. Just like with the private health insurance, they can have Medicaid. Same here applies with Medicare. So the two main ways to qualify for SSDI, for some individuals with disabilities, they can get it through their own work record. So if they're working, they're making income, they're paying taxes into Social Security, they generate their own work record and they're able to start receiving SSDI through that means. For many individuals, like I had previously mentioned, it's going to be based on a parent's work history. If they retire and they start collecting Social Security, then after a certain amount of time, Social Security reaches out about your child's and completing a new application, and they start receiving SSDI. This can also occur if a parent becomes disabled and starts collecting Social Security, or in the event that a parent passes away, which then Social Security tends to refer to it as a survivor's benefit. When this occurs, an individual starts receiving Medicaid and Medicare. It's often referred to as dual eligibility. And an important thing to note is in order to receive that Medicare after 24 months, a person has to be receiving the ABD type of Medicaid. So if you're someone that's receiving the expansion or the Magi Medicaid, you're going to need to switch over to the ABD before you can start receiving that Medicare. That's what I got.
Great.
If you have questions and you're online, put the question in your Q&A, not the chat. Kathy Tamburello, who's the vice chair of the Family Resource Planning Council, I don't know if you're able to see her, maybe you can flip your camera on just for a second, is going to be taking all the questions. If you are in the audience, if you could jot down the questions so she can sort through that and put it in some sort of order, that would be great too. The other important person is Kyoko, who you heard from, but Carrie, who's here also, are people who keep the whole organization running. If you have questions about joining the organization or how it's structured, send it to them. They're better at it than I am. So, and they'll put their emails in the chat. Thank you.
So I am the next slide, but I'm going to pause a second to see if there are any questions. And after I do my first slide, I'm going to pause and ask if there are questions because I would answer them in real time.
So Kevin has NJ Family Care, and I didn't even know there was an option for ABD or Family Care Medicaid. So his father's considering retiring. How do you go about switching? And I'm not sure how it defaulted to NJ Family Care either, because he is on SSI.
If he's already ABD, if he's on SSI, he receives Medicaid because he's on SSI. Correct. I'm going to actually, that's one of the first things I'm going to say at the introduction of my slide, with all due respect to my wonderful partner in the Medicaid agency. I'm going to talk about New Jersey's history of using the same word
I
or the
know.
same phrase
I
who mean
know.
different things, right? Wasn't there real life choices at one point in time that meant two completely different things, right? So,
No,
I'm,
you're
I'm gonna
absolutely
just,
right.
I'm gonna start with that. But is there a question online?
Can I clarify that really quickly?
You're gonna steal my thunder.
All right. You're it.
All right, there are a couple of questions and comments here in the chat. The first one is, my son is covered under my employer's health insurance. He was also approved for family care after the redetermination. We never use the family care card coverage for health care. We only have it because it's required for DDD services. Am I missing a health care insurance advantage by not using his family care coverage for health issues?
That's a complicated question. It requires a lawyer. I'm sorry.
I mean, I think it is a complicated question and it depends on the person. I think that's really the right way to think about that. There are people who, for example, would benefit from some of the services that are available through Medicaid that are probably not covered by your employer-sponsored coverage. But that's very individual. So it's worth either talking to a lawyer, since Gwen said that first, or calling our medical assistance customer centers to ask a question or two about what the benefits are that are available in Medicaid that maybe aren't covered by your employer-sponsored insurance. Is that
Yeah, I
a-
think that's fair. And I just want to, I didn't mean to be flip when I said it needs a lawyer. I'll just quickly, two issues spotting comes to mind that can be, that I hear from people. So one, and I'm hearing it a lot right now, and I'm not really clear why. We're getting a lot of people calling us on these Medicaid renewals and terminations saying, I don't want it, they're 55 and older. I don't want to be subject to estate recovery, and therefore I'm going to let go of my Medicaid because that makes me subject to estate recovery. And we say, but your DDD services come through that. And they say, I'm going to let go of my DDD services. That's one of the issues I wanted to raise in our bigger meeting, because that's a very concerning to me. The other thing that we hear anecdotally, and I want to make clear, this is anecdotal, and it's for people with private insurance, but also for dual eligibles, Medicare, Medicaid, is some providers may be unlawfully telling you if you have Medicaid, they won't serve you. And so I just kind of flagged that as an issue. And that's why I say that's a lawyer question, because those circumstances can be unlawful for the provider to do. And at the same time, they're doing it, it may result in your not being able to use that provider again. So those are very complicated, individualized situations. Yeah.
And the only thing I would add to that is it's always a good idea to make sure your pharmacy has your Medicaid card in addition to your employer-sponsored coverage. I would suggest that.
There are quite a few questions already
boy,
in the
Didn't
chat.
even get started
I
yet.
know, so I don't know how far you want to go. I
We can do
can,
one more and then.
one more,
There's a
okay.
hand up in the room too.
So I case manage children. I case manage families who have children with disabilities, and I know there's some controversies with doctors that don't accept Medicaid or do accept Medicaid, but I always tell my families that you should give the Medicaid card or drug card to the pharmacy, and also any hospital-based services, make sure it,
Yes,
so they can
yes.
balance bill. And then you have to decide whether you want to have a fight with the doctor's office, even if they do accept Medicaid. Sometimes it's easier to just pay the copay.
Yeah, and I'll just say one other quick thing on that comes up. People who are on ADD through NJ Care who meet the 100% of the federal poverty, they also are eligible for a Medicare, and they're dual eligibles, a Medicare savings program, which is a Medicaid law, even though it has the word Medicare in it, called Qualified Medicare Beneficiary, or QMB. And QMB, most people know because it pays the Part B premium, it pays the copays, it pays the yearly deductible. The other thing that it does is it's the only federal law that prohibits balance billing. And CMS, the Centers for Medicare and Medicaid Services, a few years ago changed the the Medicare explanation of benefit, EOB, if somebody is a dual eligible and a QIMBY, to say you can't balance bill. And that comes both to the Medicare beneficiary and to the Medicare provider. So it's signaling to the provider that the person has Medicaid and you can't balance bill. And that can be, that's a good thing, and it can be problematic.
I'm just going to give you one more quick one because I know this is going to be a quick answer. Paul Aronson is asking, we very sadly lost our Q point person when we lost Bev Roberts. We're wondering who is taking her place for individuals with IDD. There is Connor, who are medically complex. Connor,
The rookie up here.
you're the rookie, and you're doing a great job. Okay, we'll
Great.
save the rest of the questions for towards the end.
So I'm going to talk a little bit about Medicaid unwinding, but first I wanted to say my bit about New Jersey family care, and I'll say my bit, but then you correct me, okay? Okay. So when we present on this at Disability Rights New Jersey, one of the first things that we try and impart is that New Jersey Family Care is a brand name. It's what the state of New Jersey branded its Medicaid and its CHIP program. It's like the word Band-Aid, right?
Yes.
Band-Aid is a
Yes.
brand name for an adhesive bandage. So the state of New Jersey uses New Jersey Family Care in sort of at least two distinct ways. One way is it's the brand name for all of their Medicaid and CHIP programs. All of them fall under that brand name umbrella, even though there's individual programs that have individual eligibility requirements. So just because you're not eligible for one doesn't mean you aren't going to be eligible for another. The other way they use that term is when Connor, I think, called it expansion or Magi Medicaid. So that is the Medicaid program that was part of the Affordable Care Act from 2010. And it was implemented in January of 2014, which to me feels like yesterday. And now I realize it's 10 years ago as I'm saying this. That program was brand new throughout the country, brand new. And that Medicaid program, New Jersey tends to refer to as New Jersey Family Care, and that's sometimes administered at the state level. And notices sometimes say that, and sometimes it's really difficult to tell the difference between the brand name New Jersey Family Care and when they're talking about expansion Medicaid, Magi Medicaid, Obamacare Medicaid, ACA Medicaid, all names for the same program.
It actually goes back even farther because there was CHIP originally, which was kid care.
Right.
So we had Medicaid and kid care. And then CHIP got expanded to include the parents of those eligible children. And now they couldn't call it kid care anymore. So we're going back now. This was early 2000s. And they couldn't call it kid care anymore because it was now included parents. So it was Medicaid and kid care. And they said, well, it'll be family care. Great idea. And then some folks said, why are you making a distinction between Medicaid and family care? They're both government health care programs and it really doesn't matter to people. Call it one thing. So then the state said, okay, we'll call it all family care. And then there were all these expansions over time. And so if you have 20 people in a room and you say, what's NJ Family Care? You'll typically get, 15 or 20 different answers. But the way I think about it is the way I described it when I introduced myself, which is it's all of our Medicaid and CHIP put together under a big umbrella. But you're absolutely right that on written documents floating around in the world and in people's conversations, NJ Family Care will get used differently, like Band-Aid or Kleenex, right? I want a Coke. Do you want an actual Coke or is Pepsi okay? Like people kind of use that term very differently. And so inside my office even, I'm always very sensitive to say, wait, exactly what are we talking about?
Right.
And it's important to just kind of get to that detail. But I think of NJ Family Care, it's the name on the bags on the table. I can think of it as just, it's the overall, it's the whole program.
And to that, I would just add, and I think this launches into the slide about the unwinding, is it would really be helpful if the program that is the eligibility door for people coming in under the Affordable Care Act, the people that Connor talked about, I'm looking back at at the slide about, or it's actually on this piece of paper. It's the box about expansion Medicaid. It would be good if we could call that something distinct.
Would be helpful for lawyers, but not necessarily helpful for people in the community, right? Who just are looking for coverage.
Yes, but dovetailing into renewals, it does matter in renewals because, I'll give quick background on the process, the unwinding process, and a return to eligibility renewals, sometimes called redeterminations. You just use, so people might hear either of those words. But I think you guys are calling it renewals now as typically what it is. And this started, just about a year ago. And this was because the federal government told states, they detangled actually the Medicaid, there was a moratorium on Medicaid terminations during the public health emergency. And they said, we're going to detangle those things. The public health emergency ended up ending in May, but they said you are to start the renewal process that can lead now to a termination in April of 23. And Jen is much better to talk about the details of that than I am, but what that means for people is not for people who get SSI, but there's an asterisk on that, I have to tell you. So if you're on SSI, you're not going through the renewal process through the state of New Jersey. Whatever SSI process happens will govern your Medicaid. The little asterisk says we are seeing significant numbers of people who lost SSI during the public health emergency. They kept their Medicaid because of the prohibition on the moratorium on terminations, but now they're coming into the system. So there's a lot of confusion for people around that because it isn't necessarily timing wise aligned. But everybody else will get a renewal packet. And for the most part, it's the typical time that they would go through renewal prior to the public health emergency. So if you were a July person, it should be July again. I'm looking over here and she's going to nudge me if I get that wrong. And as we all know, if you receive services from the Division of Developmental Disabilities, you have to have Medicaid eligibility in order to receive those services. And so it's really important to this community to keep their Medicaid eligibility. And when you get your renewal package, so I'm going to say a quick thing about the SSI people because we've seen so many of them. The SSI people should get a letter, people who lost SSI, before they get the renewal packet saying, hey, you're going to get a renewal packet, pay attention to it. So people get those letters and they're a little confused. They think that's the termination of their Medicaid. It is not. It's just saying, be on the lookout for your packet. So whether you get your packet through the typical renewal, because it's the month you're typically renewed, or because you lost SSI, you got a little letter saying, be on the lookout. Now you have the renewal packet. It's really important that you complete that packet and return it in a timely way. We are telling people to send it certified mail, return receipt requested, because so many have gone awry. I know that's a big burden for people. Other people are saying, I'm just going to go down to the county welfare agency, assuming that's where it's from, as opposed to the state vendor, and hand deliver it. That's been problematic too. So I don't know what you can do. Get something stamped that you delivered it that day. Take a picture of yourself, date stamped. Some county welfare agencies used to, I don't know if they still do, have like a fake mailbox, putting it in, whatever. Because we see the problems. I should be clear about that, because you did over 2 million people, and most of them, I'm assuming, went right. We're seeing the ones that are the problem. So that's what I'm addressing there. And if you don't respond, you will receive a termination notice. It says in the slide that you may lose your coverage. I would really want to emphasize that you're going to get another letter that's going to say, because you failed to return your documents, you're now going to be terminated. Sometimes after you send back the renewal packet, you'll get another letter, a request for information, because there's something missing that they need in order to assess you. And the sort of broad-based thing I want to say about this, and it ties back to knowing what kind of Medicaid you were on before you went into the public health emergency. We're finding it really difficult, and we have a lot of expertise, figuring out, was somebody on Magi Medicaid? Was somebody on New Jersey Care? Where were they in March of 2020? And we can debate whether or not that's relevant information, but what we're getting is most people who are getting terminations are getting terminated under NJ Care, which is the program tied to 100% of poverty, even if they never were on NJ Care. And that can cause confusion. And the concern is that you are not being screened for all potential Medicaid eligibility, because that's just one program. Maybe you're eligible under the higher income levels that go along with the DD supports waiver. Maybe you're a disabled adult child and eligible under that program. Maybe you're eligible under the new workability, which is, so much more robust than it had been before. And so making sure that that screening happens is one of the things that we have found tricky. Like, that's part of the work that we're doing at Disability Rights. So the last thing I'll say about this slide, and then I'll pause for questions, is we did a webinar on some of the top problems we were seeing back on January 29th. It's on our website. We did it twice, at 12 and at 7. I think they just put up the 12 o'clock one, but if they put both up, watch the 12 o'clock one. It just had a bigger audience, so got a lot more questions, which I think are helpful for people to hear. And the other thing is, that webinar gave a lot of, I hope, useful information and helpful hints, but ultimately said, if you're facing a termination, call us. We're representing, thank you, New Jersey Council on Developmental Disabilities for supporting this work at Disability Rights, but we have a cadre of lawyers and we're coming in on almost every single case. We have reached the point where we are referring some to our wonderful partners at Legal Services or Community Health Law Project, because we're all figuring out how we can serve everybody. But I don't think anybody has, with an intellectual or developmental disability, hasn't had the opportunity, mostly through us or through one of our, other stakeholder groups, to get actual representation by an attorney in these cases. So I'll pause there. Did you want to add anything to this?
Why don't we take a couple of questions?
Sure.
No, I want my. I want my SSI in December, and I got a New Jersey family here. Action. But I was interested, but I was able to get back on some social security. What is there anything I need to do with NJ family care, or now that I am back on social security, is that no fine?
So I'm going to answer that, and if I make mistakes, please do correct me. So we are also seeing people who are circulating on SSI right now. I'm not quite sure what that is, but we've had a couple of those people who were on, then off, and then back on, and then maybe off again, and then maybe back on again. I'm not quite sure what's going on there with SSA, but if you are back on SSI, then there should be no problem. It can't hurt to call the MAC, right? To verify that, and the numbers are on the table over there, the Medical Assistance Customer Center, to make sure there's nothing wrong with your, and the slides, great. So the other situation is people who lose their SSI and don't go back on to SSI, and those people are going to get that renewal packet that I mentioned and be screened. And if there's any questions that you have, just call Disability Rights New Jersey, and I believe it's in our information.
Yeah.
Are you getting DD services?
Yes, I am.
You are.
The problem for me is I did a federal internship and actually in October, I went over, so I got a notice in December saying you're over the limit. However, I I paid down and I was able to get back on last month. So I know what I didn't. So that's what happened to me.
Yeah, the only other thing I'm gonna say about that, and it's something I think I've been practicing now, I think I'm in my 35th year. That's a long time, and I've only seen it twice. And that is, there's a program through SSA called 1916B that is for people who have received at least 1 month of cash assistance through SSI. And if they start working, and so they're no longer, income eligible for SSI because of their work income, but otherwise they remain eligible. They continue to be resource eligible and meet the criteria for disability. They're supposed to stay on Medicaid through 1916B. And so one of the things I'm going to say to Jen, maybe at some point we can figure out how many people in New Jersey are on 1916B and whether or not the Social Security program is doing what they're supposed to do with that program. Because I hear stories like this a lot, and I'm not sure why they aren't flagged
Right.
by SSA.
Why didn't he go over there?
Why didn't he go over there?
How do I make sure I get 1916B?
Yeah, that's the question. I'm not really sure of the answer. And so we may look into that a little bit, why that seems to not work a lot.
So that would be happening on the federal side.
Correct.
Is your name Dan? I'm trying to read
Yeah.
your name tag. Dan, if there's any concern for you on the Medicaid side, definitely, as Gwen said, you can call our customer center and ask a question like, is my eligibility current?
Oh,
Right? What eligibility group do I fall into? You can ask those questions, and then Gwen and I will look at the federal question too. Okay?
Oh,
lot of
okay,
questions.
okay, that's, all right, so, the next slide is a related slide on, a return to the eligibility renewals and what can you do now? So the first suggestion is a really basic one, which is to make sure that, Medicaid has your correct address, because you don't want that renewal packet being sent to the wrong address.
Yeah.
So there's a telephone number there for that. We're coming to the end of these, so.
I was gonna ask, has everybody gotten theirs? By now, just about everyone in this room should have theirs. Okay, so you would be in the March cohort, right? Because March is our 12th month. It's our 12th cohort. So you would be getting yours this month if you haven't received it yet, and you're welcome. No.
No.
So just a quick summary. We started, as Gwen said, we started last April. We had 12 cohorts because the federal government said you have to do it in 12 months. 2 million, thank you for feeling that way, because that's how I feel. She said 2 million people. Yes. We had to initiate 2 million people in 12 months. We will not finish 2 million people in 12 months. But we will have started everybody. So mostly we tried to keep folks in the month that they had previously renewed. So we kept sending renewal mail all through the pandemic. And if you responded to that renewal mail, let's say you got it in July, I think that was the example you gave, and you responded, then we tried to keep you on the same month. And then everybody else, we kind of spread, peanut butter spread, we called it, across the year pretty evenly. And there's one exception, which is our workability group. Is anybody in the room covered under the workability program? So that group, Kelly, that group we moved to the very end. So they were January, February, March. So that whole group, nobody went in the first 9 months. They're just coming up now. But we have other folks who are in the peanut butter spread of January, February, March also. So you should be receiving your renewal mail this month. And as Gwen mentioned, there are letters going out ahead of time. One of the things going out ahead of time is a postcard from your managed care organization. And it says, keep an eye out for your renewal mail. It's coming soon. If you see that postcard, it's your month. So you should look out for that like this week.
So, other, you know, one of the, so the next bullet is about making sure that you don't exceed resource limits. And this bullet is generally fine to say to people. However, it's again, a pretty complicated individualized question for what that resource limit is. So I don't want anybody to think that they are necessarily the $2,000 resource limit, which goes with SSI or goes with New Jersey care, waiver program. So like the DD supports. Other people are $4,000. So that would be the New Jersey Care, the program that goes up to 100% of poverty, allows a little bit more resources. People on workability, completely different situation. And so if
Can
there,
we talk about that for a
yeah,
second?
please do.
So we've expanded the workability program. Are folks generally aware of that? I don't want to waste your time if you already know. No? Okay, workability. Good morning, Antony. Workability, we've been working closely with our community partners. We expanded it last year. There used to be a cap on age. So if you were over 65, you couldn't do workability anymore. We took that away. There was a cap on assets. You couldn't have more than $2,000 in assets.
No, it's like 20 or
Oh,
something.
was it?
It was high.
It was high.
Yeah.
Okay. We took that away. So now you can, for example, have a 401k and save money, right? For retirement, stuff like that. And then what was the other change? That spouse income doesn't count anymore. And what we're currently in the process of implementing is also removing income limits. So up to any income, a worker with disability will qualify for workability. That piece, that last piece I just mentioned, was the hardest piece to do in our system. And so it took a little bit more time than the other pieces that we implemented last year. But we're in the process of rolling that out right now.
So, and that's really exciting. And thank you for that. I think it's probably the most expansive workability program in the country, not without other concerns. So I'm going to go back to my SSA thing again. We're seeing people who are being terminated from their Social Security benefits because they exceed substantial gainful employment. So that's another issue that at some point we have to kind of think about beyond the scope of this conversation. But what I want to point out is that the resource limits are different depending on which program you're on. And so, yes, you want to be taking a look at resources. That's very important, but it has to be tied to the program that you either are on or you're going to be moving to. So that too is something that if you don't know, you can feel free to call us at Disability Rights New Jersey. And we have found that some people got resources during the public health emergency. Maybe they inherited some amount that is important, but isn't, $500,000. Like they inherited $30,000 during the public health emergency. And so that is good to talk with an attorney. ABLE accounts are one of the things that people can use. And for people where there's a more substantial amount of resources that came into being during the public health emergency. That could be a special needs trust, and that does require an attorney. We don't do that at Disability Rights New Jersey. That is the private bar, but paying attention to resources can be important. If you get a termination notice, there is a number on it that you can call for more information. Depending on what that number is and who answers or doesn't answer the phone, that can be helpful or not helpful. I think the more important thing is that the form should have, first of all, I said this in my, keep every single page and number them on the bottom in pencil, 1 of 5, 2 of 5, because we're finding by the time they're getting to us, people don't have all the pages of their notice, and it makes it really difficult for us
That's true.
to do stuff. So, that's my little helpful hint on that. But there is a page that says how to request a fair hearing and continuation of benefits. Thank you, State of New Jersey Medicaid. Continuation of benefits are automatic. Now you don't have to check off a box saying you want them, but you do have to make that request within 60 days. And while you have 60 days to make it, if you do it after the termination date, your Medicaid will be terminated. Once you request the fair hearing, you'll be turned on, back on, but you will have a gap in services, which can be very problematic and stressful. We're encouraging people to request, people in this community, not in every community, but in the community of people who are receiving services through DDD, everybody should be requesting a fair hearing and continuation of benefits. And then the next call is to us. So request the fair hearing and continuation of benefits. There's a fax number on the form, I believe. Yep.
Yeah.
And then call us and we'll help figure out what's going on. And every single person we've represented has ended up getting their Medicaid back. Sometimes through another program. Sometimes they had to spend down some resources, set up an ABLE account by way of example. But everybody has remained Medicaid eligible, which is so essential for the DDD services. Did you want to add anything to that?
Nope.
Okay, great.
Cool.
I think I'm done. I don't know if there were any other questions. Otherwise,
Let's do it. Give us the boatload.
Okay, if the income for a disabled young adult is over $2,000, can you give an example of an alternative? And I'll just add to that, I think for some, my son actually is in this boat. Our Social Security this year just went over $2,000. So,
then you would come through, I'm going to use an old-fashioned term, but it still has legal meaning. You'd be coming through the institutional door of the DD supports waiver, which has a higher income threshold. So does MLTSS. It's the same income threshold. And I don't have the number memorized. I don't even know the 24 number, but the 23 number was 2,700 and change.
okay,
If you're above that, there's a legal question. You're above
Okay.
that limit. People on MLTSS use qualified income trusts.
okay. If a person is disabled and they have SSI, then the parent has SSDI and the parent passes away. The disabled individual has to receive SSDI for 2 years before being eligible?
No,
No.
they'll move. Somebody on SSI who has a parent who retires, dies, or becomes disabled should be getting their SSI should be moving to SSDI. And they should be a disabled adult child. The problem we're seeing with those in the county, another issue that would love to solve systemically in New Jersey, is the counties are allowed under the regulations to attribute a fair share if the person is not paying fair market room and board. And that calculation is kicking some people off of Medicaid. So if you get that, and then they're not being sent to be screened for the higher income program. So if you have that situation, call us. Or you
Okay,
can call Connor also. You may be doing that as well.
Yes.
okay, you have 2 people to call. My daughter is dual eligible. Increasingly, doctors will take her Medicare, but will not see her when they find out she has Medicaid. I think many people have had this issue. Do we have options? I asked if we could just use her Medicare or pay privately, and have repeatedly been told that that would be fraudulent. Can you clarify?
It's a problem.
It's a problem.
It is a problem.
Docs should not be turning away patients who are in this situation. We do, and when we hear about it, we call their office to have a conversation. Our 5 managed care organizations also do this. And meaning also call the office to have a conversation with that doc. And this is one of the great complexities of the American healthcare system. And to be honest, there was a time when I held up other healthcare systems as better and smarter and stronger than ours. And during the pandemic, I saw those, internationally, those healthcare systems really struggle in different ways. So I think it is a piece of the system that's not perfect. And I would like to have a lot of conversations with those doctors. But I would also say, and then I'll have to hand off to you. I would
No, I'm
also
good,
say, it is our intention that every one of our members will get the care and services that they need through this healthcare program. And so we work very closely with our managed care organizations to make sure if someone's having trouble accessing a specialist, that they in fact do have access to a specialist. And so while that can be challenging for folks at times, I want you to internalize that it is our responsibility to help you get access to that care. And so you should call your managed care organization. You should ask to speak to a nurse care manager who can help you through this. And if you have any difficulty there, please don't hesitate to call our customer center, and ask for help through my team.
The only little quick thing I'll say, and then I see Nana T has her hand up. I do know people who keep their Medigap policy. This is usually more older adults, not necessarily younger adults with intellectual or developmental disabilities, though I don't know why the same theory couldn't apply. I'm not quite sure about Medigap. There's a young age that you can't get it, an age below which you can't get it, but they use the Medigap policy because the Medigap policy will pay. What the doctors want is they want their copay, right? Because Medicare doesn't pay, it pays 80-20 of Medicare allowable rates. And so they want their either 20% or their 35% that they get on top of that. And so some people use a Medigap policy, which then is the second payer, and then Medicaid is the payer of last resort. And by that point, the doctor's whole. And I don't know, that might work in some cases. Because there's an age. Yeah. Yeah, I don't have it memorized, but I can look it up and answer that, what the age is.
I have a question about balance billing issue that prevents Medicaid enrollees to be accepted by certain practices, and it happened to my daughter. My question is, how do other states deal with this? My understanding is that it's not really as serious an issue in other states. So that's really my question. Seems what's unique about New Jersey that is preventing Medicaid enrollees to access medical care because
Yeah.
of balance billing?
We do work very closely with other states, and I don't think there's anything that's unique about New Jersey. Other Medicaid directors I talk to have this exact problem, and I had this problem when I worked in Florida. But that being said, we don't know what we don't know. So if somebody says to you, my cousin in Idaho doesn't have this problem, I'll be happy to call Idaho. But there's 56 Medicaid programs between the 50 states, DC, and the territories. We meet regularly, and this is a topic that we've discussed. So I don't know anybody who doesn't have this challenge.
No, I think it flew under the radar for a long period of time, and people did private pay the copays.
Yeah.
And I think what changed, and I don't have the exact year, but remember I said it's now on the explanation of benefits, and it goes to the providers. If the person is a QIMBY, this person's a QIMBY, you can't balance bill. And so I think there might be a heightened awareness with providers that they didn't have. And that went into effect around 2015-ish.
Okay. My daughter has my workplace private insurance. Oh wait, I'm reading the wrong one. I'm sorry. My daughter, age 23, will be receiving Medicare in June based on her own work record. She currently has private insurance through me, retired teacher's insurance. Which insurance will be primary, Medicare or my private retired teacher's insurance? Also, she has Optum RX for prescription coverage. Will she maintain that coverage through me? She takes several expensive medications, and I'm concerned about the prescription coverage. Finally, will her Part A and Part B premiums be automatically paid through Medicaid?
So that's a question that begins by saying she should call her, or you, the person who's asking the question should be calling their um, uh, representative regarding health insurance to get the question answered about which is first, Medicare or the private insurance. It's different depending on, sometimes Medicare is first and sometimes private insurance. So I would never, I don't, even if somebody called me, I would never speculate. I would say,
answer.
you've got to call your employer and get the answer to that question. And then there was more there, but she could certainly look at applying for Medicaid at this point in time as well, which might be a benefit also, especially when you start talking about prescription drugs.
Okay. Do we need to tell our employers, health carrier, and physicians that our son has Medicaid? If we tell them, will it interfere with the coverage under the employer plan?
We need to tell our employer.
The doctor, if
I
that
think
they
the
have
employer
Medicaid,
is the question.
private insurance and Medicaid.
This is a question. Do I need to tell the doc or do I need to tell the employer?
The employer.
Oh, the employer.
Do not need to tell the employer.
I don't think so. I'm not
I don't
100%
actually know that.
sure. Yeah.
Sorry.
Okay. My daughter receives several phone calls asking her to change Medicaid to a different Medicaid program, which offers a $500 per month credit card in addition to New Jersey Medicaid coverage. Should she make the change? All of her current medical costs are covered 100%. Is this a scam?
I think that's probably, she's a dual eligible, because I don't,
Medicare Advantage.
it's a Medicare Advantage that's offering that. It's not, she's probably in like a D-SNP kind of thing.
Or maybe she's not.
Or maybe she's not.
Somebody has recognized that she's dually eligible and she could enroll in Medicare Advantage, and that Medicare Advantage plan is offering extra benefits. Or that call is a scam, right? We don't know. Just sitting here, just to be quite honest, and I don't know about you guys, but I'm very careful about the calls, emails, and text messages I'm receiving these days. But, you know, if you got a call from one of the major brands that we are familiar with, or even one of the minor brands that you see on the internet, like, just be careful. I think we couldn't say from hearing that exactly what the case is, but it does sound like potentially a Medicare Advantage plan.
And I think you can also call the SHIP. The SHIP might be able
That's a
to give
great
some,
suggestion, yes.
help them untangle what's going on. It's the state health insurance program.
Mhm.
And if you Google SHIP, you can find their
Yeah.
telephone, New Jersey SHIP, you can find the telephone number.
They're wonderful. They're seniors volunteering to help other folks understand Medicare. I used them when I needed to help my dad with his Medicare, and they were just phenomenal.
Okay. My son has workability. His SSDI is too big for SSI. Is there an ABD program for him if he can't work?
So that's a great question. And that's one of the things I'm a little bit concerned about with the new workability resource, the lack of resource limits, that people may reach a point where they're no longer going to be working, and what's going to happen to people then. So I'd say a couple things. There's definitely other programs that he may be eligible for. Again, you can call Disability Rights, you can call the ARC, and we can talk through some of those programs. Some of them are on the wonderful sheet that Connor brought with him today. There is, though, this potential other question when somebody's coming off workability now, where people are going to have more resources. And that is, how do I remain resource eligible? Because there is no ABD program that has the kind of generous resource limits that workability have. They're either 2,000 or they're 4,000. So that may require planning with a private attorney if somebody has $150,000 in a retirement savings, there's gonna have to be some significant planning around that, to have somebody come off of workability and go on to a traditional ABD program.
Yeah, well said. And there is complexity to all of that, and it is very unique to individual circumstances. We really do suggest consulting an attorney on that. And I would also mention that we have an eligibility team that is specialized for this, understanding that there are trusts in place and, you know, special circumstances in a lot of cases. Some of you know Brian Brennan on our team, who works closely with advocates and families to make sure that we're navigating some of those very individualized questions the right way.
I think we're handing it back to you now, the next slide, right?
For
No? Oh, great.
But Pat told me as she came in that she wasn't going to do it, so, all right. Oh, and by the way, what Gwen said about having the right address, that is real stuff. I thought I was on top of things, but Maddie's package came to her group home, but not really. It went to the door to the house that was attached. And it wasn't until I said, gee, I haven't heard from these people. Maybe I should call the Board of Social Services. And they told me, oh, no, you've already received a letter that you were going to be disenrolled. And so I called Disability Rights New Jersey. Fantastic people. They were very calm. They asked all the appropriate questions. It took about 4 months to straighten out, but it ultimately was straightened out. Okay, page 12. Does your primary care physician accept your insurance? Does your preferred hospital accept your insurance? And this is a good question because I see this question from families all the time. And the question is usually posed as, do you guys know a hospital or a doctor who accepts Medicaid? That's not the question, because it's the provider who's providing the insurance, which is the question. So it's important that you select the right insurance company, because you need to check, hopefully before you select that insurance company, if they cover your doctors and your preferred hospital. But even if you can't, or if you don't get around to checking that insurance company, you can change, Connor, I think within 90 days of the selection. All right.
And you can really change, Dottie, you can change anytime if your doctor says, for example, if you're seeing a specialist who says, I don't take your insurance anymore, but I take this other one,
Okay.
then you can change then too.
Okay, thank you. The other questions are, does your pharmacy or durable medical equipment provider accept your insurance? And does your hospital ancillary services accept your insurance? What are ancillary services in
Like
durable medical equipment?
so durable medical equipment is everything from wheelchairs to adult diapers.
Oh,
And ancillary would be if you are receiving personal care assistance, help with bathing and dressing and toileting from a home health agency. That's an example of ancillary services. There's
Okay.
others, but I think that's the one that would be most relevant to folks.
Okay, so on the right side of this slide, you'll see the link to get an overview of each insurance company. You'll also see the New Jersey Family Care Health Benefits Coordinator number. I've called them before. They're very helpful, very nice. And then the links to provider network for each insurance company. Okay, back to
Dottie,
page.
can I say one thing before we flip away from
Absolutely,
this?
yes.
Just so you know, speaking of Kleenex, Band-Aids, and J Family Care and other things, health plans are in the habit of renaming themselves. So Fidelis Care used to be WellCare, which had other names before it was WellCare, but most of you will probably remember it as WellCare. And then WellPoint was Amerigroup.
Oh.
So if you ever had Amerigroup, they have renamed themselves WellPoint. So I just wanted to share that.
That's great. Okay.
Yes, basically.
happens.
What was that? Look, did- Oh,
Is this well-care? I just started getting letters from them. And I was throwing them away.
Yes.
My healthcare, my prescriptions to my son. And then after a while, I read it, and then I called them up, and it took forever to get an ID card. And they take care of the prescriptions, they said, not United Health.
Well, it sounds like he might have changed health plans, and I don't know why that would have happened if you didn't make the choice. But you can choose your health plan. So if you used to have United and you want United, you can have United. Right? Those are the providers that you're connected to. It sounds like maybe he shifted over to
Yeah.
Fidelis. But whichever card you have right now, if you call them up and they say you're eligible, that's the plan you're with.
Healthcare center.
okay. One second. I'm sorry. Can we just, Paul? I understand. I want the microphone to come to you.
This is something that happens every year. Medicare, unless you alter it, will assign you a prescription drug plan that has no monthly fee. That's why they shifted people this year to WellCare. That was the only that was the only Medicare Part D plan prescriptions that had no monthly fee and was allowed to accept new patients. So at our agency, everybody was shifted over to WellCare for their prescription drugs.
Thank you, Paul. So this
Right.
is an interaction between Medicare and Medicaid, right? I'm talking to you with my Medicaid brain and Paul's like, no, there's a Medicare thing happening here. Thank you.
But you should also know that you don't have to take that WellPoint plan. You do have options. You just have to pay a minor premium if you don't want to take their pharmaceutical plan. I learned that by looking up the ARC of New Jersey's archives on Medicaid plans because they have a very, very full archive.
I just want to be, for the record, that we're talking about
Which
I-
has Optimum, and through my military, TRICARE for Life, Express Script, I didn't have to pay for anything anyway. Then this came about.
So these are very unique circumstances. I think Gwen was about to say, where you have Medicaid, there's Medicare in the mix, and it sounds like you have TRICARE in the mix. So let's just all be careful not to confuse each other, right? Very individual circumstances.
I just
Okay.
want to say a quick thing about Medicare, because Medicare, you know, used to be somewhat clear. It's alphabet soup and less so now. So some people have original A and B, but what you're talking about right now, I think, is Medicare Part D for the drug benefit. Some people have a Medicare Advantage. The drug benefit is built into the Medicare Advantage, and that's actually Medicare Part C, but nobody really refers to it that way anymore. And then for dual eligibles, there are these D-SNPs, dual eligible special needs plan, and they are a product that combine the Medicare and the Medicaid and in one thing. So there's just so many different ways this plays out that there isn't, it just is very personalized.
Yeah,
think,
I
is-
will say, my daughter's in a DSNP and I've never had a problem with a copay because they do work together. The problem though is you have slightly more limited choices in your doctors and providers. It's not like regular Medicare where you can go to anybody. But there are, as you said, Gwen, this is a very ambitious agenda. So I think I'm going to leave that alone. We have one more question from the audience, and then we're going to move on.
All right, moving on. What's next? Slide 13, that's me. Okay, so I know we've already touched upon a lot of this information out to this point, as it's been a very robust presentation. But circling back around to the private health insurance and Medicaid, I'll just reiterate some of these points because they are so important, that a person with a disability, they can have that private health insurance and Medicaid. And again, this is usually going to be through a parent's employer and their employer-sponsored health insurance plan. The individual must have Medicaid to receive DDD services when they're eligible at age 21. This is imperative. You can't have DDD without the Medicaid. They go hand in hand. In most cases, just like with the Medicare, the private health insurer through an employer's plan, they're going to usually act as the primary payer or the primary insurance, whereas Medicaid is going to be the secondary payer or sometimes referred to as that payer of last resort. And as Jen had touched on before, when it's medically necessary, you're going to find that Medicaid does cover certain services that might not be covered by employer-sponsored plan. For example, this can include incontinence supplies or personal care assistance, which can have to do with, those activities of daily living and assistance with day-to-day tasks. I had also I hadn't talked about this before, actually. So just want to put an asterisk here that a smaller number of individuals, they might not be able to get that SSI or Medicaid at 18 if a parent has already retired, become disabled, or passed away. That's when they start receiving that SSDI. And this opens up kind of a unique pathway that sometimes an individual can be found eligible through the DDD waiver unit, and they actually reverse the process, and you're going to apply for DDD before getting Medicaid. This used to be referred to as non-DAC. I know DDD's not necessarily calling it that anymore, but until we have a better name for it, I'm going to keep using non-DAC. Circling back around to the Medicare and the Medicaid as well, just to reiterate, dual eligible individuals are those who are receiving both services. And the same thing, the Medicare is usually going to act as the primary health insurance, whereas Medicaid is going to be secondary. And this is some of the points that we were just talking about before. But when that person becomes eligible for Medicare after those 24 months, they're going to be enrolled into Part A, Part B, and what we were just mentioning. Usually you're automatically enrolled into a benchmark Part D Medicare plan. Those are the benchmark plans that they don't have the premiums associated with. I believe in New Jersey for 2024, there's 2 such benchmark plans. There are also the optional Medicare managed care plans we had mentioned, Medicare Part C, or more commonly referred to as Medicare Advantage, as well as the D-SNPs or the dual eligible special needs plans. And when you're a dual eligible individual that's receiving both Medicare and Medicaid, Medicaid is going to help with paying those costs, which can include the premiums, deductibles, coinsurance, and drug copays. And once again, Medicaid is really great in helping to cover certain services that might not be covered by Medicare. This include a whole range of things from dental care is the big one to home health aides, podiatrists, and eyeglasses. So Medicaid is really big in helping pay for costs, but also to cover certain services that aren't going to be covered by Medicare or a private insurer necessarily.
Can I add one quick thing? Because it came up before and I just quick looked up the answer. Medigap, there is one Medigap policy, Horizon, that's available to people under the age of 50. However, there are lots of disqualifying criteria that you can be denied. And so the best thing to do if you're interested in a Medigap is to call the SHIP and go through options with the SHIP.
Mhm.
Well, I think you. No, okay. We'll go. He said no. Oh, okay. Oh, you got it.
So I remember Beth Roberts, bless her soul, really impressed upon me and some others that if you have a private insurance plan, Medicare and Medicaid, then the original Medicare A and B, then you do not enroll in Part D, but use Medicaid to cover for your prescription, to take away all the copay. And that was what I had to do. I disenrolled from Part D, and then Medicaid picked up
all the co-pay so that it became zero. And I think this is really important to keep in mind. You don't have to deal with the Medigap and so on, or find Part D that is suitable and more limited to you.
So I have a question about that then,
No.
because I don't know the answer to this. So I know, for example, somebody who's on PAD, the pharmaceutical assistance for the aged and disabled, they have a Part D that hides behind that they might not really know that they have, like the state enrolls them through, whatever that Part D extra
Extra help.
Is that not true about Medicaid? There isn't a secret Part D in the background?
For Medicaid coverage for
For-
pharmacy?
Yeah, for Part D.
The MCO's paying it.
So there is a secret. People are in Part D, they just don't realize it. In PAD, people are.
I have not had this question asked this way. So we included in the managed care capitation, the amount of money that we pay to the MCOs each month is coverage for all of the Medicaid covered costs, which would include pharmacy. So I don't think of that as a Part D plan in the background.
Okay,
But
it
I-
might not be.
I guess I've never been asked that question that way, so I need to go back and think about how I think about it.
We get a statement every month and it shows that extra help picks up all the additional costs
Yeah,
for the Part D plan.
so there is a Part D lurking in the background.
On the Medicare side.
Yeah,
Yeah.
yeah.
So I remember having to go on the federal website to disenroll my daughter from Part D. And it did require some prior authorization, but after the initial paperwork, it was very easy. And it just reduced all the copay, and she does take a lot of expensive drugs with copay, even after having the private insurance as primary. I remember so
Just
clearly.
incredible drug coverage.
Are there any online questions?
Only 34. Um,
There's an in-person question. I don't know,
Okay,
behind you.
We could kind of go back and forth.
Yeah.
Hi, our son is currently 5 years old and physically disabled, and we have private insurance through my husband's employer. How do we apply? And is there income limitations for Medicaid, Medicare? I don't even know what we would need or what we would be eligible for. So who would we reach out to?
So this is the point where Jen is gonna discreetly reach under the table to the rotten fruit that she has down there and throw it at me.
I would not.
So children can always apply through the programs that cover children, one of which the Magi Medicaid New Jersey Family Care does not require a disability determination. And for children, that's up to 147%. And that's based on your tax return. That counts income differently than ABD program. So you can look at your adjusted gross income on your tax return, and basically it's gonna, not perfect, it's not a perfect alignment, but it's close. And the numbers for 2024 just went up this week, so they're available on the website of the Medicaid agency, so you can see what that number is. Or an age blind and disabled program can also, which have a different way of counting income and resources. Having said that, for many families where there are working parents, the income is going to be too high for any of those programs. And so eligibility is going to have to be in one of these waiver programs that I referenced before as an old-fashioned word I was using, but institutional financial criteria, which look at the children just by themselves without deeming of parental income or resources. And that is in flux. Is that a fair way to say it? In flux is maybe the wrong. There is one program, MLTSS, but a child needs to need skilled nursing to get into MLTSS. And for children with IDD, the state is working on it. It's,
Mhm.
it's a process that's coming. I like to say soon and very soon.
Yeah.
Mm.
Because every family is different, I always suggest you call our customer center and ask them a few questions. You can talk to them about your income level. You can talk to them about your son's disability, and they'll walk you through how to apply. I mean, it's also available online.
Okay.
But every family's circumstances are different, and I think it's helpful to talk it through with somebody. So that would be my suggestion to you.
And one last thing I would recommend is to take a look at the Perform Care website and.
Yeah, we just actually applied for that
Yeah. Oh, you
in
did?
the process,
Good.
yeah.
That's
Okay,
also Medicaid, sort of.
sort of,
Sort of.
Thank
sort
you.
of, kind of.
But,
Pay for it.
yeah.
So, why are Medicaid MCOs not required to cover providers in border communities such as New York or Philadelphia? A requirement that apparently exists in some other states, and a requirement of the MCOs covering New Jersey state government employees.
Why are they not required to cover border communities? Is
Like
that what
if
the word
somebody-
was?
Yeah, somebody
Yeah,
wants to
okay.
go to New York
Got
for a
it.
doctor or Philadelphia for a doctor.
You know, we actually do have quite a few out-of-state doctors who participate in our managed care networks. But this being a New Jersey program, you know, what we have set up is a requirement to provide adequate networks within the state of New Jersey, and then also to ensure that all specialty care and frankly, primary care is available to our members regardless of where they live. And so that's why we do end up with doctors who are out of state participating in our managed care networks, because to your point, there are border communities where it's not just New York and Philly, right? It's sort of all up the Delaware River, where folks, particularly in rural areas, may need access to an out of state doctor. So the program is New Jersey focused, but we do have a number of out of state docs who participate, and hospitals too.
Okay. Who dropped the ball on Medicaid premium increases alignment for dual eligible insurance subscribers that never had to pay for their Part D coverage? This occurred after open enrollment 2023, beginning January 1, 2024. Did no one from the state of New Jersey notice this approval?
I don't know what that, I'll be
Yeah,
honest, I'm
okay.
not really clear what that question means.
I'm just
I
gonna
think it's
say,
tied into what was talking about before,
okay,
that there was only one Part D and something happened with that, but I don't know the answer to that question.
all right. There are 35 questions, so I'm gonna try and weed through them. If we don't get to your question, we will try to get it answered after the event. This question relates to a 60-year-old disabled individual who receives SSDI through her own work history. She is not eligible as a DAC. She is currently employed part-time and is on New Jersey workability. Her employment is about to terminate. We understand that she is also on a Medicaid waiver. She is receiving 24/7 DDD services from an agency. It is critical for her to retain Medicaid coverage to continue to be eligible for DDD service. What is the process to proceed so she continues to qualify for Medicaid and DDD services so there are no loss of services?
The big issue for somebody who's been on workability is going to be their resource eligibility. Once they're no longer working and they get SSDI, it's rare, if ever, I've seen somebody who is above the institutional income limit that I mentioned before. I'm going to say around $2,700 a month. So it's usually more a resource issue, and that question really depends on how much resource the person has. If the person has $15,000 in resources, maybe they use an ABLE account to spend down, so they're below 2,000 for that program. But if they have retirement savings of $100,000, you know, which is possible for somebody who's been working for a long time, then they need to see a private attorney to set up a special needs trust.
Okay, here are two. I'm going to put them together. They're on workability also. A young man could not get workability because of SSD. He got, I guess, SSDI when his father passed away. And the second part being, when is workability being redetermined for eligibility? Someone had heard it was this month.
Yeah, I can answer the second part. I didn't understand the first part. Did you?
I did.
Okay, far away.
Oh, I think the first part is around, that there used to be a prohibition, in workability regarding unearned income on somebody else's work record. And if I heard the question right, the SSDI was on somebody else's work record and it wasn't disregarded. I believe it is now, or maybe that's phase two. Phase two, yeah.
Oh, I see. This was, okay, thank you. This was, I guess that counts as unearned income.
Correct,
Yeah,
yes.
got it. Thank you for grabbing that. So phase two is being implemented right now. And when I say it's being implemented right now, I mean, we have put all of the pieces in place, right? We dug the foundation, we built the walls, we put on the roof, we turned on the lights. We're watching it now to see if it works. So we're not talking about it. We're not, Nantini recently got an email. We're not publicizing it because we don't know for sure that it works. This piece was a little bit complex and needed a minute. So we're literally like last week, this week, we're watching the cases come sort of move through the new process to ensure that it works perfectly. And then we will begin to celebrate and share that information across the community. We just want to make sure that it frankly, that it doesn't crash, right? So the rocket is lifting off and we're watching it closely. With workability renewals, I think I mentioned a little bit earlier that we moved the workability folks all to the last quarter. So they would receive the initial mailing January, February, or March. If you haven't received it yet, you're in the March group, is where I am, or something has gone wrong. You're in the March group, and you should be getting a postcard from your managed care organization over the next week or 10 days that says your renewal mail is coming this month. Keep an eye out. And then you will get your renewal mail mid-month. Those of you who have already received it have had this experience. You'll get your renewal mail mid-month. And if you don't get it and you forget, ideally, you are also getting a text message, an email, and a phone call from your managed care organization at the end of this month saying, by now you should have received your renewal mail. So hopefully there's 3 opportunities for us to grab you there. One is the postcard. Your mail is coming this month. In the middle of the month, you should get that renewal mail. And then at the end of the month, by now you should have received your renewal mail. And if you didn't, there's a phone number to call.
May I just ask a question about workability? I think one of the 5 elements of workability expansion that the law, according to the law that was signed on January 10, 2022 or 3, I don't remember, was, I think 2023, was that there is a provision of 12 months of continuous coverage in case of a job loss. Mm-hmm. Now, that provision is not a feature in the state plan amendment that states have to submit to CMS for approval. However, my understanding is that states can make that change administratively. The question is, when is that going to happen? Because this is an element in the law that was signed and passed, because the 12 months would really help individuals who just lost the job to spend down or to set or to transfer assets and open an able account or do things or even find a new job. It makes such a huge difference. I think this is something to follow up on.
Yeah, some important stability after a job loss. So one of the less joyful parts of my job is figuring out with the federal government how to get their sign off on programs that we want to move forward, because they pay at least 50% of the bill, depending on the program. In this case, they said, this is a program for people who are working, not a program for people who are not working. So in the state plan amendment, we were not able to include the 12 months post-job loss. It really requires a waiver. And these are, you're like, what's the difference, right? The difference is that the state plan applies across the board to the whole program in a way that the feds just couldn't approve. But a waiver would say, we're gonna do something slightly different for a specialized population. Sometimes we're able to move something that way. So without getting too deep in the administrative weeds, this is queued up for our next conversation. It's a conversation we're already having with the feds, and queued up for the next discussion around what we call the 1115 waiver and amendments that we would be making to that. So I think, we're all on the same page. It's in the law. It's a good idea. We just administratively have to get to a place where we have federal approval to do that. And I think they're on the same page too. It just needed to be a different vehicle.
Can I ask a question? And if the answer is you don't know, that's fine, but I think I alluded to it before and I want to say it explicitly now related to workability. We are seeing people who are losing their SSDI because they have substantial gainful activity. They're exceeding the SGA. And so has there been thoughts about what's going to happen to those folks who receive DDD services, so are eligible for DDD services, to the extent that they can't go through the medical review team to get a disability determination for 12 months, right? There's a prohibition in our state regulations. You have to have a disability determination to be on an ABD program. Workability is an ABD program. And you can go through the medical review team, but if you have a negative determination from Social Security, you have to wait 12 months. So have you thought about how those folks are going to get disability, have a disability determination that's acceptable for workability?
I don't think I can answer that question myself on a Saturday morning,
Okay.
but my medical director and my eligibility team have been working through a bunch of MRT questions lately. And so, I think that is one of the topics that's
At
sort
some
of
point, there will be a good, clear answer on that. Okay, great. Thank you.
All right, I think these have been answered, and we're just gonna reiterate, this person's son did not receive his recertification on workability, so that should be coming now, because they were at the end of your cohorts, right?
Yeah, and if you have any concern about eligibility status, always feel free to call the customer center and ask.
Okay, so they called the county and we're told that they have added 6-month period and he will come up for recertification in May, is what this person's being told.
Sorry, May. So always individual circumstances. It's possible that they were able to do a background review on the case, maybe last May, and determined that he was still eligible, and they were able to push him out for another 12 months. I'm not
Okay.
sure, right? Every circumstance is unique.
I'm not sure I understand this. I'm just gonna read it and
Okay.
hopefully you do. Even non-PAR providers can bill Medicaid OON on
Out of network.
oh, thank you. As secondary or family can sign a waiver, and then they gave a link. So, it's not really a question.
Yeah, I think they're making the point. Yes, exactly,
okay.
about doctors not accepting that.
I think while we're on that subject about providers not taking people that have Medicaid when they have other types of insurance, they accept Medicare. I like, does CMS, I mean, is there a rule that if you take Medicare, you also need to take Medicaid by
No.
CMS? So it's not worth reporting providers who to CMS to let
It's
them know.
great to report them to CMS.
Oh, it is.
So, yeah.
Please
and there-
report them to CMS.
So there is a federal regulation that says if you provide if you're a certified Medicaid provider and you provide services to somebody who is a Medicaid recipient, you must take it. So some of those, that's why some of it's each doctor could have a different situation, but some of them could well be in violation of the law, right? That they don't, you can as a Medicaid provider refuse to take a new patient, right? You don't have to take every patient. The MCO rules may be different than that, but in traditional fee-for-service I'm talking about the federal law right now. But if they see somebody and provide the service and the person's a dual eligible, they do have to participate in Medicaid, whether they want to or not, for that service that has already been delivered.
So we have a lot of conversations with docs. My team has a lot of conversations with docs, asking them to honor the patient-doc relationship. And, people are in different places on this, but from the Fed's perspective, docs cannot balance bill these members. And at the same time, we want to preserve access, and Medicare and Medicaid need to work hand in hand on that. And patients need to not be stuck in the middle.
I'm just being a little cognizant that we have about 15 minutes and I think Connor has 2 more slides to do.
Okay.
Okay, so now we'll get into a little about what you should do in certain situations if they don't take your insurance. And Jen will give me a kick if I misspeak on any of these. So I know we've already mentioned some of these topics, but what should you do if, say, your preferred medical provider doesn't take your insurance or isn't in network? And what we had mentioned before is with your initial enrollment with a Medicaid MCO, you can change within those first 3 months or 90 days of your new enrollments. There's also the annual open enrollment period. That's every year. That's from October 1st to November 15th. Or I believe Jen had touched upon earlier, say if you need to see a specialist or someone that you can't access in your network, but they might be in network with a different MCO provider, this would be something that'd be a good cause that you can go to your MCO about switching over. To do so, you can call the NJ Family Care Health Benefits Coordinator at the phone number provided there. What should you do if the waiting list is very long? I'm going to reiterate some of the same things here. You can look about seeing a different provider in your network. There's always the possibility of course, cancellations or new scheduling opportunities opening up with the provider. You should always be looking to call your doctor's office, looking to get in contact, see if there's any cancellations, because they might not always be right on top of updating their availability. If there's really a specialist that's not available, again, you can always call your MCO, look about changing them if necessary. If there's an extraordinary long waiting list and you need to see a specialist, that's a good reason to call your MCO and say, hey, I need to see the specialist. And, where can you get me in network with a different specialist that can see me in a more timely manner? That's absolutely a good cause.
Especially if it's medically urgent.
Yes.
You want to say to
yes.
them, this is medically urgent.
If you can't find a health professional that will accept your insurance, and I think as we had talked about before, that some providers may be wrongly or unlawfully not taking Medicaid patients, that's a different issue entirely. But again, a lot of the same things here. See if there's a different provider network with your MCO. There might be, if it's someone that's not highly specialized, if it's more of a general provider, you might be able to provide someone different that's in network and can see you in a more timely fashion. You can call your MCO about finding that provider in a different MCO if it's absolutely necessary. And you also want to make sure you're mentioning the actual name of your plan. Just don't say NJ Medicaid. Don't, try and help them out. Say who your provider is, give that information. And again, if you have to change your MCO, you can do so during the annual open enrollment period or outside that period if you have that good cause that you need to see a provider in a more timely fashion, especially if it's life-threatening or it's very urgent. Absolutely. Okay. So the last few here, if the list of health professionals is out of date or expectancy is far away, I know, Jen, you had mentioned this, that they're in the process, the Medicaid MCOs, of establishing the online digital forms for complaints. I don't know if you want to touch upon that at all.
Yeah, do you mind?
Sure. No, go ahead.
I was telling Connor the other day that we have a new requirement for the MCOs. I haven't said this yet today, but I know you all know it already. Caregiver stress is real. Caregiver stress is real. And a conversation that Bev Roberts and I had a while back was like, maybe people shouldn't just like only have the option of calling their MCO or writing to their MCO, but like caregivers are awake at 2 a.m. on the internet. Maybe they should be able to tell their MCO over the internet that they're having trouble finding a provider. Anybody else? I mean, I personally am doing my caregiver stress at 2 a.m. Okay, thank you. We told the 5 MCOs, you need to have an online form and it needs to be simple. And people need to be able to say to you, I am looking for a certain type of provider, whether it's physical therapy or a neurosurgeon. And I'm having trouble. This is where I live. This is what's going on. Very simple form. And each of the 5 MCOs built that form. 4 of them are already live on the internet. The last one is coming up March 15th. And then I'm going to send those website links to the team so that you all will have access to them. But it's basically, if you want to tell somebody at 2 a.m. that you are having trouble finding a neurologist, like that is the way to do it. You are still welcome to call, send a fax, messenger pigeon, whatever. But I think that online resource that you can use anytime will also be helpful. So that's something Connor and I were talking about. As soon as we get that last one of the 5 live, then we'll go ahead and send out those links so they're easy to use.
And I think the last big one here is, can I go out of network? So generally, you're going to want to stay in network. If you use out of network services, there's no guarantee you might be on the hook for full out of pocket medical costs, which, as you all know, can be quite high. So it's a loaded question. It's going to depend upon if you have Medicare, if you have private health insurance, if you have both and you have Medicaid. It's going to be very individualized on your circumstances. But for the most part, you're going to want to make sure that you're seeing a provider that's going to be in network with one of those insurers. And there's going to be bigger networks, there's going to be smaller networks, depending on who your insurer is. But generally, you're going to want to stay in network because you might be on the hook for those full out-of-pocket costs if you go out of network. But there are exceptions.
And can I take the last bullet, denial of healthcare coverage?
Absolutely.
So there is a appeal and complaint guide for New Jersey consumers in your packet by the Department of Banking and Insurance. And I have no doubt that the Department of Banking and Insurance knows their own regulations well and produces a very lovely brochure. But it is not a brochure that includes Medicaid MCO rights. There are other managed care organizations, right, through private insurance. So that brochure is about that. It's about private insurance. It is not about Medicaid. Medicaid beneficiaries have more rights that are rooted in the federal law when they get an adverse benefit determination from a managed care organization, from their Medicaid managed care organization, not talking about their private insurance right now. And so that can include denials, reductions, terminations, authorizations of services for less than what the person asked for. I want 40 hours of PCA. You gave me 30. Well, that's not an adverse benefit determination. We gave you 30. Yeah, it is under federal law, and that comes with appeal rights internal to the managed care organization. Under certain circumstances, an external DOBI process, for example, private duty nurses or other medical situations. Some don't have the external DOBI process, for example, personal care assistants, and then a Medicaid fair hearing right. And all of that, which I was part of a national organization when these regulations were being looked at, and we begged that people didn't have to request fair continuation of services over and over again in a 10-day frame, and we lost. So unfortunately, under federal law, you do have to keep requesting each step of the way continuation of services, and you get 10 days from the date that the notice was mailed, which is absurd. But that is the federal law. So I would say it's a lot more complicated for people who are getting service adverse benefit determinations on service authorizations through their managed care. And we have a crisis of private duty nursing cuts going on right now in the state of New Jersey. I was just on with Community Health Law Project and separately also talked to Legal Services of New Jersey. And we are going to be grouping together and starting our joint advocacy in April with the Medicaid agency about where we think the managed care organizations really are not complying with the requirements under federal law and all of the contract, and holding them more accountable, because this is really a critical service for people who receive it. And it's in crisis at this point in time. Unfortunately, that crisis is happening at the same time as the renewal process. It's not the renewal process, but
different.
it's completely different, but coincidentally, it's exploding at the same time. So, that is a big issue that we're looking at.
We work through stuff.
Yes.
We work through stuff.
Right, I'm gonna try and run through a couple questions here pretty quickly. There are a few questions that if a family has, an individual has private insurance through their parents or through another way and Medicaid, they're told that the private insurance is primary, the Medicaid is secondary. Can that be switched? So Medicaid is primary? No. So the answer to that is no.
Yeah, Medicaid is always the payer of last resort. That's what they call it. But
Okay.
I will point out that Medicaid often covers services that are not covered at all by the private insurance. So in
Right.
that case, Medicaid is essentially running primary, right? Because the private
Okay.
insurance is denying it.
Okay. I think we did that one. My son receives a Social Security survivor benefit. He has Medicare and I received the application to switch him to ABD Medicaid. Sent in the app in December. In January, I called and they confirmed it was received, not processed yet. DDD told me his Medicaid expired on 2/29 and I still have not heard anything from Medicaid. Does this mean he loses his DD services until this is resolved?
No,
No.
I would definitely want to get a call from that family to DDD. It sounds like there's a disconnect.
I'm reading tea leaves because I've seen this pattern
Okay.
a lot in the last 10 months. Jen gets emails from me sometimes on the weekend and her staff saying, my husband's mad at you all again.
It's true. Our spouses have been through a lot.
Spouses have been through a lot. So it's sounding to me like at the beginning of the public health emergency, this person was on SSI. They started getting a derivative benefit on a parent's work record at some point during the public health emergency. And so they got that letter theoretically that said, hey, you're going to be terminated from Medicaid. If you don't do something, you're going to get a blue envelope. And they got the blue envelope, the renewal packet, they returned it, it's still being processed. But what was happening, and thank you Medicaid agency for not doing this anymore, is when they started that process back in the summer and fall, they were putting a date in the system that the person was terminated 4 months in the future. You aren't doing that anymore. This may be a legacy of that. And that's why the termination date is showing up, even though it sounds like the county hasn't processed the renewal yet. That is a call to us, an urgent call to us.
Well, and also,
Also,
yes, and
yes, and
this family has a contact at DDD and may also already have a contact in Medicaid eligibility because a lot of families do. And they're welcome to call and point that out,
Okay.
right? Because it does sound like there is an issue. They're also welcome to call Gwen.
And
But ideally, we can work through that one. It does sound like a technical snag
sounds-
in
yeah,
the way that a
and I-
disconnect.
And I thought, and John isn't here today, but I thought, and we've been seeing that people are getting their DDD services, are not imperiled for 3 months, I think, after the termination date.
Everyone's working very closely to make sure
Yeah.
we're not getting gaps where we can possibly avoid them.
Green month.
3 months.
For DDD. You know, that's what I was told.
There is some stopgap measure that DDD is doing, and they're not here to exactly explain what they're doing, but there is some stopgap, and the main thing is that he gets back on Medicaid.
Right.
Okay.
And there's a team at DDD that works very closely with my Medicaid team to make sure that we're bridging that gap for folks and where there is a technical disconnect, that we're connecting it back up again.
Okay. This actually isn't about insurance, but I'll read it. My daughter is deaf and now living in housing for individuals with special needs. I've been trying to get the facility to provide a sign language trainings to her staff, but keep hitting roadblocks. Can I turn to Disability Rights New Jersey to help me get services provided by the agency for these trainings? Sign language is and has always been her primary language. She attended schools for the deaf all of her life.
The answer to that is yes.
Yes, you can call Disability Rights New Jersey. Okay. If the renewal application was sent in September 2023 and haven't heard anything, they should be following up with,
Yeah, feel free to call the county or call a customer center and ask for your eligibility status. I will say certain counties, I mean, 2 million members in 12 months, certain counties are still working through it, right? So they're doing their best to manage the volume, but I wouldn't want you to take a chance. So feel free to call and ask your eligibility status.
okay.
Kathy, can we do just one more question? Would that be okay?
Sure.
Okay.
And there are still some other questions. Some of them are duplicates. Please reach out to us if your question has not been answered. Will my daughter, who is currently covered under employer coverage, disabled adult, be able to use COBRA when my husband retires in addition to Medicaid?
I don't know the answer to that question. The husband can COBRA. There's
Yeah.
also tricky rules about COBRAing and being on Medicare, so they should really make sure that they've talked to their employer about that. But I don't know the answer about a child who is on employer-based insurance under New Jersey's special rule beyond the age of 26 and whether or not they have COBRA benefits. I just don't know the answer to that.
Okay. All right.
Okay, I want to thank everybody. I particularly want to thank our panel. Gwen, Jennifer, Connor, you didn't have to be here on a Saturday. And you did, and I think it was made very clear during this session that you guys are advocates, that you care about this population. And I really appreciate you sharing what you know and trying to help us. For the rest of this, we're going to break for an hour for lunch. If you are online and you are a chair, vice chair, or a significant leader in any of the regions, stay on. We're coming back together at 1 o'clock to talk about some primary issues. If you are a member of a region and you have a question that needs to be brought up in our afternoon session, go contact your chair, vice chair, whatever region leader you have. But again, thank you, Gwen, Jennifer, Connor. This has been a really full session. Thank you.
You're welcome.